Vaccination has successfully ended pandemics and has built our resistance to serious illnesses. But is it possible for a vaccine to have a negative effect and cause infertility? Find out now in this episode of COVID-19 Mythbusters. At this moment, the World Health Organization, WHO, states that there are more than 226 million confirmed COVID-19 cases and over 4 million deaths. To respond to this crisis, vaccines have been identified as a suitable method to help societies return to normality. Vaccines prevent more than 20 life-threatening diseases, and immunization currently prevents 2 to 3 million deaths every year from diseases like diphtheria, tetanus, influenza, and measles. The COVID-19 vaccine does the same and provides added protection against the virus. But are rumors of negative impacts such as infertility true? Are vaccines safe? For many, the launch of vaccines from companies like Moderna, Pfizer-BioNTech, and Oxford-AstraZeneca seemed sudden. Questions appeared regarding the safety of the COVID-19 vaccines and their side effects. The WHO notes that typical side effects of COVID-19 vaccines include pain at the injection site, fever, fatigue, headache, muscle pain, chills, and diarrhea. Not included in the list is infertility, but it has been widely discussed as a possible side effect of being vaccinated against COVID. According to Harvard and Oxford-trained plastic and reconstructive surgeon with a PhD in immunology, Dr. Ramon R. Scott, rumors of vaccines being linked to infertility have always existed.
There are still a lot of questions outside of this. Fertility. There was a debunked theory that the polio vaccine, one of them, there are two types of polio vaccines, using the continent of Africa, years ago. Remember I said the live attenuate is like the gunman without the gun and the killed one? You have both types for polio. You have a live attenuated version, which is oral, and then you have the killed one that they inject you with. The live one was affected fertility. And they proved that it didn't. But then it perpetuated. But that may not even be the origin of why they think they're linking infertility with vaccination here.
Dr. Arscott explains that the belief that infertility will increase because of the COVID-19 vaccine may be based on a misunderstanding of its formulation. He said,
there was a letter written to the EMA, I believe, that's like the FDA of Europe, okay, by two erroneous claims that the spike protein has a molecule called syncytin, SYNCYTIN 1. Now, syncytin, or syncytin, however you want to pronounce it, is a critical molecule for placental development. And so they're like, if you create antibodies against the spike protein, then you're going to create antibodies or handcuffs against the placenta. So there is no such thing. There is no syncytin on the spike protein. It's not like it even looks like it. No such, and they have debunked it over and over. It does not affect fertility.
While there are theories online and in other spaces, there has been no evidence to suggest that COVID-19 vaccines can cause infertility. The U.S.'s Centers for Disease Control and Prevention, CDC, says, currently no evidence shows that any vaccines, including COVID-19 vaccines, cause fertility problems. That is, problems trying to get pregnant in women or men. The CDC made these comments based on a recent report created using their V-Safe COVID-19 vaccine pregnancy registry, which showed that 4,800 people had a positive pregnancy test after receiving a first dose of an mRNA COVID-19 vaccine. This indicates that the COVID-19 vaccine has no impact on fertility. If you're still concerned, you can do your own research on each vaccine, but consider speaking to your doctor to find out more. If you've made the decision to get vaccinated, visit the Ministry of Health's vaccination website at vaccination.moh.gov.jm, social media on Facebook, Instagram, or Twitter, or contact the ministry at its hotline at 888-1-LOVE. Get vaccinated. Get back to life.